Hello, wonderful attendees. I'm your host, Dalvinder Kaur from Lovely Professional University. Get ready to dive into today's topic, that is career opportunities in allied health sciences. Before we proceed further, allow me to introduce the experts of the day. Dr. Naresh Kumar, Associate Professor, School of Allied Medical Sciences, Lovely Professional University. With a PhD in microbiology and 17 years of teaching experience, he has published 6 books chapters, 3 books, and 20 research papers also. And he currently guided 8 PhD students also. So now I would like to introduce the admission nominee also in this webinar, Mr. Rishabh Sharma, Officer and Area Coordinator at the Department of Tie-Ups, Division of Admission, Lovely Professional University. Mr. Sharma plays a pivotal role in connecting the university with various institutions and organizations. Before we proceed further in today's session, I would like to request everyone for any questions. You can write in the chat box or in the Q&A box, and same will be addressed from my side in the end of this webinar. And now I hand over the things to Dr. Naresh Kumar, and it would be an absolute delight to listen from him. Over to you, Dr. Naresh Kumar.
Okay, thank you so much, ma'am. So good morning to everyone. I'm going to start today's presentation. Now, is it fine, ma'am? Just tell me.
Yes.
Hello.
Share your screen, sir.
Okay, I have to share.
Yes.
Yeah, could you please tell me that's fine?
Yeah, the screen is visible. You can continue, Dr. Naresh.
Okay, ma'am. Okay. Thank you so much. Thank you for the introduction. So today's session, I'm going to take on that opportunities. What are the opportunities in allied medical sciences? So there may be so many students from the different stream related to the medical as well as the non-medical. Sometimes we are referring the person from the genetics, the person from the another sciences, but they are come somehow they are contributing to the medical sciences. So that's why they are coming under the one roof that is called the allied medical sciences. If somebody is in the biotechnology, somebody from the agriculture, somehow they are contributing to the medical sciences. So that's why it is known as the allied medical sciences. It has some specific course also, but now as per the government nomenclature, now they are saying that allied health professionals bills that is introduced in the Rajya Sabha and the Lok Sabha that has been passed. So now the allied medical sciences, it's a big kind of the discipline, big kind of the school and the medical sciences, where the people are in any form, they are contributing to the medical sciences. Either they are from the pharma, they are from the physio, they are from the biology, they are from the biotechnology, they are from the genetics, from anywhere, the microbiologists, etc. So the person who is contributing to this field now, it is known as the allied health medical sciences or allied medical sciences. So the people who has done their diploma degrees and the masters as well as the PhD. Now, what are the job opportunities after completing this? So first of all, that what is the medical laboratory sciences? Allied medical sciences, it has a several kind of discipline, but now they are the specific one also, the medical laboratory sciences. A medical laboratory sciences is that clinical laboratory which are dealing with a lot of tests they are doing day by day. So every day, whatever the test has been done in a laboratory to know that what is the problem with the patients. Because once the diagnosis is right, then the treatment would be right. So this is the one science which are taking the sample and finally they are analyzing. So these people are clinical laboratories, example of applied sciences, opposed to the research laboratory. The focus on a basic science such as the found in some academic institutions. So medical laboratories in a very in a size complexity offer a variety of the testing. So if I say this, how this distribution of the medical laboratory sciences is there. So at a local level, like on a district level, zonal level, and international level, national level. So their laboratory distribution are the different. As well as if the test is increasing, diagnosis is increasing, complexity also increasing. Nowadays, the new diseases are coming up. That's why the small laboratory can perform the limited number of the tests. Whenever they need some specific testing, they are sending these all tests to the reference laboratories to know the exact diagnosis of the patient. That's why these distribution of the laboratories are different. More comprehensive services can be found in an acute care hospital, tertiary care hospital, commercial medical laboratory, that it is a independent laboratories. Now this is the one field, medical laboratory sciences, or the person who has done the course of the allied medical sciences. There are the one opportunities if they don't have the job somehow anywhere in a hospital or anyone, so they can start their own work. So this is called the commercial medical laboratories, operate independent business and provide the testing to the otherwise not provided in the other setting due to the low cost volume of the or the complexity. So here is the opportunity, the person they can provide service to the community independent. So ultimately, if the person are not getting the job anywhere, so this is the one field that they can start their work at a after completing their diploma or the degrees or the masters. So medical laboratory sciences, here is the discipline experiencing the fast growth and commitment to the challenges of the 21st century. You know that recently the COVID happened, so most of the people are in a trouble. What to do? So even the healthcare professionals, they are totally, you can say, the paralyzed. They do not know what to do because they don't have the diagnostic kit. So nowadays, so many viruses are coming up, so many diseases are coming up. They are still paralyzed to give the final treatment to the patient due to the lack of the diagnosis at the early stage. So what is happening? You just imagine, it is estimated that by 2025, there will be a 24% increase in a demand of medical laboratory professionals. So if you just look into this one, the person after completing this clinical laboratory or the allied medical sciences course, where they can find the job, it's a huge, you can say the opening in a different sectors. They can become a clinical biochemist after completing their master degree in a clinical biochemistry. They can become a clinical biochemist in a national, international level, or in a local level, also in a laboratory. Clinical microbiologists are the persons who are handling the microbiology testing. You know, that every person having some kind of the infections. They are taking the samples from the different areas, maybe the nasal, it's maybe the mouth, or any other kind of the pus where the pus happen, lesions happen, scar happen. So they are taking the sample and finally they are isolating in a laboratory, and after the isolation they are testing the drugs also. Once they isolate the bacteria, then they do the testing also of antibiotic, which antibiotic can be a good one for the treatment. So it is the different kind of the laboratories. In a one hospital we find hematology, histopathology, biochemistry, microbiology, and so many other laboratories, toxicology, forensics, etc. Many laboratories today we found in a big tertiary care hospital. Tertiary care hospital is that where almost all kind of the cases they handle, either burn patient, liver disease, IVF, etc. Any kind of the disorder, they are going to handle it. Primary health center, they can't handle all the patient. So tertiary care, where all kind of the facilities are available. So if you are going in a such hospital, you may find the lot of department, and where they are doing the specialized person in a specialized laboratory, they are doing the work. So laboratory assistants, they are simply the person who has done diploma in medical laboratory sciences. They can become an assistant also. In a colleges also they can do. Now like or a institution like LPUs there, cities there, so many other universities are there who need a person who are trained in a laboratory processes. So they, even if they don't want to go over there in a main line, they can come to the institutional laboratories also to conduct the practice. Biomedical scientist in the UK, medical laboratory scientific officer, CLS, clinical laboratory scientist in the US. So there are the so many students who are working as a clinical scientist in the foreign countries also. So after completing these allied health professional courses, the people can be appointed in India and outside of India. Any country they can go because their course mapping with us is highly mapping. Almost 100% mapping is there. Whatever the disease would happen, it is happen to everyone. Every human is the same kind of the blood group. Only their skin color may be different. Otherwise, every disease and etc. that would be same. That's why the person who has done the study here, that would be applicable to the any country. That's why the medical laboratory person do not. There is no too much obstacle to go abroad to perform the testing. So that's why this medical laboratory sciences or allied health courses are fantastic to find the job in anywhere in our industry in India and outside of the India. Medical laboratory technicians, clinical laboratory technician, so they can work in a US also. Medical laboratory assistant, as I already talked about. Phlebotomist. What is a phlebotomist? The person who simply collect the blood, who are simply taking the blood and sending to the laboratory. So in India nowadays we have the reference laboratory. Dr. Dang is there, Metropolis, then there's the Lalpath. There are so many laboratories who are just appointing the phlebotomists. Phlebotomists are the specialized person who's simply collecting the blood, because this is the first step. Right collection, right diagnosis, right treatment. So once the wrong sample has been collected in any vial, that may lead to the wrong treatment also and wrong diagnosis also. That's why. Histology technicians. Who is that? Histopathology. The person who was dealing with the histo means the tissues. The people having the some kind of a trauma, tumor. They are receiving in a laboratory. They are analyzing whether the patient having the tumor or not. Tumor doesn't mean the person may have the cancer. Scientific officer, they are the laboratory persons who are handle each and every samples. Medical technologies, these are the different kind of designations which are given in laboratories. If you find there is a one application manager is that the person who are simply doing the calibration and giving the training to the medical laboratory professionals how to operate the automated system. I'm going to repeat it. The person, suppose we are buying the new instrument in our laboratory, but how it is to be operated, how to do the calibration, what is the application of this instrument. There are the specially trained manager who is known as the application manager. These are the person who has done the BSc medical laboratory sciences or the master. They can become the manager in any laboratory. So they are simply doing the work of the company. They are installing the one machine. The installation engineers are different, but they are telling that how it is working and what are the parameters we can take out of it. What is the credibility of each and every parameter. So that's kind of the job is there for the application manager in a laboratory sciences. Another is the sales executive, biomedical instruments and the reagent supply. This is the one sector which are day by day increasing. If you just see that in India we are at a first stage, at a top. I won't say the first stage. We are on a top in a cardiovascular disease, right? Heart disease, diabetes, just because of. Just imagine how many people are visiting to the hospital for the medical diagnosis and finally the treatment. So just imagine how this laboratory's diagnostic part is increasing day by day. Another is the clinical laboratories are supplied by the another multinational companies. Focus now here with the Thermo Fisher, big company, which has the global life sciences instrumentation, $47 billion. Now it has been increased because these are the companies who are providing the instrumentation. But to sell it, the material as well as the instrument, they need a trained person from the either from the master MBA or from the medical laboratory sciences. So who can sell the better one? So the medical laboratory professional, they have the experience how to operate the machine. So they become the manager or the sales manager in a companies like this. And in a general laboratory equipment, including the lab centrifuge, then transfusion solution, purification system, transfusion machines. So many things are there in a laboratory sciences. It's not a single. Simply when we are going to treat, primary diagnosis, instrumentation required, reagents required, manpower is required, operating system is required. So everything, software is also required. So in all these, the multiple peoples are working only to find out the right diagnosis. So there are a lot of jobs in every sector. So if you just think about here in vitro diagnosis, our market is estimated about $61.22 billion with the companies. Roche Diagnosis, most of the instruments in hospitals, Abbott Diagnostics, Siemens Healthcare, Johnson and Johnson, Beckman Coulter, the one of the leading company. Earlier, the first automated system of hematology made by the Beckman. Now just imagine how many companies are there in a market. So day by day increasing, molecular diagnosis increasing almost 10% revenue. Transfusion diagnostic, So biorad laboratories, so many laboratories are there which has a high business. So what kind of the instrument they sell? This is the one instrument. Just imagine when the person earlier they were doing the the estimation in a laboratory, doing the analysis. The one test they need a half an hour. One test they need a 2 hour. One test they need a 24 hour. But now if we have the so many samples, when 20-30 years before we have the 20 samples in a lab, so we can easily perform by the manual technique. But now per day more than 1500 samples are coming up. Manpower is short there, so more manpower is required. So nowadays the automated system, what is the benefit of it? Here if you just see into this one, we have to separate the sample, put into the machine, and within 1 to 2 hours you can get almost a 200 samples report. Just imagine that what is the achievement of this biomedical instrumentation system and how it is now applied in a medical laboratory sciences. Just imagine Edua 120 bias diagnosis I talk about, Siemens Healthcare. How their instrument is quite costly. I think 70-80 lakh rupees. But what is the benefit of it? Single instrument can work a lot of sample. Almost you can perform per day, per hour, more than 60 samples per hour. Just imagine this is the one machine. Here is the another, now the new things are coming up. Earlier we used to perform the testing, manual testing, to check the cells color. So earlier there was a lot of error. Sometimes the diagnosis was wrong. Cancer diagnosis was wrong. So now we have the automated system in a staining. Staining means that we are giving the color to the cell. And here the automated system in which it's giving the exact timing of that, the coloring system and a coloring of the cell. So that's why the minimization of the wrong reporting is happened just because of the automation. Automation, identification, susceptibility. What is this? These are the instruments who are measuring the antibiotic. I'll give a very simple example. The person who is listening this one, suppose somebody having the infection. Doctors do not know what medicine is going to work on this particular patient. So when they are sending the sample to the laboratory, in a laboratory, they are doing the testing on a microorganism. Primarily, they are finding out the bacteria and they are doing the drug testing also, that which drugs can be helpful to kill this bacteria. So this is a wonderful machine that nowadays available in most of the hospitals. You just see, the earlier you might have listened that while you're going in a blood bank, that we have to go give whole blood. They are taking 350 ml, 450 ml. But just because of the dengue every year in a Punjab and other states where the too much dengue, chikungunyas are coming, which are destroying our cell, which is known as the platelet. These platelet may leading to the bleeding. That's why the new things have coming up in this machine. They can take the single cell. How wonderful it is. Earlier we used to take the whole cell, then we are separating and giving transfusion to the patient. But nowadays, if the donor is going, whatever we need out of the body, we can go and just give only what we required. So this is the achievement of the diagnostic field. So day by day increasing the demand of these supplies. Molecular diagnostic, DNAs, RNAs. So nowadays the molecular techniques is a fast. Suppose somebody having the tubercle infection, TB, and sometimes the patient having the HIV infections, we are not able to detect fastly. We need a lot of time in a TB infection detection. Approximately sometimes may require 3 days, sometimes require 7 weeks, sometimes required 4 weeks, etc. This technique has hastened up the things, and it can give within a 24 hour. Just imagine 3 to 4 hour of a infection, we can get the report. If you have given a sample, within 3-4 hours we can get the report and treatment can be started. Now I'll just tell you that what is the Indian scenario, diagnostic industry structure. Diagnostic industry, INR 675 billion, that is the one. Hospital 37, standalone centers 47, diagnostic chains are 16. What is it? A standalone center means the person who having the regional chains, their own small labs with a basic test. 47%. That's why I said after doing the allied medical sciences, they have the very, very huge market to do the job. Nowadays, you know the scenario of the whole world, even in India, 45% people are unemployed. So here, this is the what is the field. This is the one where the person can they start. 47%. We need a more people. 37% in a hospital. They need a more people. Diagnostic chains are 16%. They want to open more. So if you just look over here, radiology, it's not our part. But yes, of course, it is allied health medical sciences. But if you see over here, in a urban is a 65, and in a 35% in a this one. Corporate are handling 10% and walk-ins are 35. If we just see, if we increase the demand of a rural areas, so there are the lot of opportunities in the rural areas where we can start our laboratories, we can start our own work. Reason behind, the governments are giving the 50% rebate. If somebody is doing the training in allied medical sciences, they want to open their diagnostic center in a rural areas, especially in a Punjab. 50% they are giving the, that's a concession in a whatever the loan has been taken for to open the laboratories. So now the diagnostic sector is a huge, as I already talked about. So diagnostic segment is a critical component in the healthcare sector globally. Approximately 80% of the physician diagnosis are result of the laboratory test. So earlier it was happening in India that the people are just looking or feeling the pulse. Then they are telling that what is going on inside the body. Earlier the people are hardly get ill. Some people even they have the fever after 10 years. But nowadays, day by day, because of the sedentary life, because of the food, because of the air, because of what we are eating, now day by day the disease are increasing. Sometimes the doctors are not able to know what is the problem. So most of the doctors nowadays all depend upon the diagnostic system. Diagnosis wrong, treatment wrong. So there are the three mainly types of the test which is done: routine test, clinical laboratory test, monitor the disease and drugs treatment, and especially test the genetics, immunology, oncology, endocrine. What is it? Genetics. Now the genetics testing is what? I'll give a very simple example. Sometimes they are the somebody having the baby, right? But they are not sure that it is our baby, or so they can go for the genetic testing. They can tell whether this baby belongs to the same parents. Another, some people having, the father having the malignancy, cancer. Now they want to know, am I carrying that genes? So it can be done through the genetic study. Some people having the Parkinson disease, where the trembling is happening in their hands. They are not able to control their whole body. Peripheral nervous system totally disorder. So now in this condition, if they want to know my forefather having that disease, do I have in an older age? So this test can be done at an early stage. So immunology, where the person immune weak, immunology where the HIV patients are there, older people are there, babies are there who are immune weak. So what we do in immunology, oncology is related to the cancer. Now the therapy has been given for cervix cancer, breast cancer, mouth cancer. Now what is the treatment is going? The treatment is going right or wrong. So there are the tests which is done pre-starting of the chemotherapy, post-diagnosis of the cancer. And now after that, they are again doing the testing, the benefit of the chemotherapy, whether this cancer is giving the good kind of conditions, good kind of response to the therapy or not. So these can again done. Endocrinology, most of the people may be knowing, because there are some, most of the people having the thyroid problem, luteinizing heart problem, sex hormones problem. How it is to be done in the endocrinology. So these are the tests, especially tests because of the costly. So these tests done in a special laboratory. Abhi just look, Indian diagnostic industry, so where this is the one major growth drivers: increased insurance penetration, aging population, rising income level, preventive care, wellness, rise of the. Nowadays, the most of the people are aware. They want to go to the hospital because they know that my father having the cardiovascular disease. Now they are going to the hospital. They are getting admitted. They are getting for or simply that knowing the test. They are going for routine checkup. So if you just think 30 years before, scenario was different. But nowadays, most of the people, because they do not know that what kind of the disease I'm carrying from my parents, from the conditions, ecosystem. So now they're going to the hospital for the routine checkup. So early diagnosis, if there is some problem, heart disease do not happen in a day one. It may be early, but when it happens, it's difficult to treat. But sometimes if we get the early diagnosis of the heart disease, it can be treated with some precautions, simply walking, reducing the fat, etc. Just I'm telling you that how the people are knowing about all these things. So just look into this one. The medical laboratory scientists, the people earlier they know, yeah, that they are taking the test, then doing the few testing, and manually they are. You just look, these are the students, and how they are working on an automation system. So nowadays, the automation system, what is the benefit? You know, the most of the people, HIV, HBsAg, HCV, so many people are coming positive. These machines having the benefit that they are directly do the testing without touching the blood, and they are wearing the gloves where the chances of the touching, they can take the sample, put into the machine, directly analyze. Some are we need a handling also. So the sectors or the career opportunities, biomedical scientists, research laboratories, lab entrepreneurship, they can start their own work. Hospitals they can go. Clinical research and management. Clinical research. Sometimes the doctors has given the medicine, pharma has made the medicine, but this medicine is working on a human in a right way or not. So that is done under clinical research and the management. If you just remember the few days before, what happened, that the people are dying after the COVID vaccine. So where the problem was happened, the problem may be the proper research was not done. That's why, because at that time the corona was there, so companies has made a very fast to control the corona. That's why the proper research was not happen, and that's why it's giving the adverse effect in so many people. Not all the people, but every person's body having the different response to the drugs, different response to the vaccine. That's why the people are getting problem. And how it is feeling, if the clinical research has done well, it can be done easily. Development of the diagnostic kit. When the COVID was happen, no one knows what test to be done to know the COVID. So what was happen, in a 3-4 day, the scientists of India, they develop the kits to know that what is the patient having the COVID or not. Compliance control, they are checking the policies, what to be adopted to know the early diagnosis, what the better can be done. So they have the compliance. We need to find out what kind of the policies we can make that run the laboratories, run the hospital, etc. Quality control. Quality control is that which are they running in a hospital, whether the test generated from this laboratory is absolutely dependent or not dependent, whether this report is right or there is some variation. If there is a variation in this laboratory report, so patient would not be healed. That's why to run the control is basically the sample which has the known value run into the machine. If it's giving the right value, it means the all sample which are going to be run, that would give the right sample. So here is the opportunities in a quality control officer. So most of the hospitals having this quality control officer, they are simply going running onto the machine, and they're checking whether the machine is giving the wrong report or right report. This is the only simply work of the medical laboratory scientific officer. Intellectual property rights, if you develop some kits, it is our own right, it is our own product. So there are the huge opportunities. Process product development, all the time there are the we have the opportunity. If this particular reagents are giving this value, so can we enhance with the more adjustment, with the more changes? So that's why the research as well as the processes changes, we can get the good reports also. So the people are involved in this kind of the sector also. Pharma companies, and the most of the people. Now how this clinical laboratory person can work in a pharma? See, the pharmacy person, they are designing the drugs, how the sterilization to be done after the packing, how the sterilization to be done, whether the lot which they are sending out, it is microbial free, it do not contain any kind of the contamination. Contamination means any kind of the adulteration into it, simple language. So the person who is from the clinical side, they are appointed in a pharma company, they are doing the sterilization of the drugs, and finally they are checking that the drugs which is supplied to the market, it do not contain any kind of the adulterating materials, bacteria, fungi, etc. What was happen here in Punjab, there was one company, I won't take the name of that company. They have supplied the one injection, and when the nurse has opened it, it has a fungus, black color fungus, fungi. It is a contaminated. It means it was not properly sterilized, not properly made. If that fungus may be given to the patient, patient definitely die. So just imagine there are the different sector where the allied health professional people can do the work. Research laboratories, diagnostic laboratories, entrepreneurship, as it already discussed about it. Now, the entrepreneurship, the person who can do DMLT, they can open, BSc they can open, clinical microbiology, clinical biochemistry, and now we have the one more, clinical embryology. So clinical embryology, they need to keep the some gynecologists also, but they can start their IVF center also. Okay, with the totally depend upon their uh, available finance. So here the higher education, the people who has done, this is the one there. If they don't want to go in a further qualification, they don't want to do further qualification, they can go in a PhD also as a teaching staff. Okay, and clinical embryology, so they can have the specialized also. Here BSc MLTs are there, they can open their lab, but if they want to learn more about it, clinical embryology they can join, clinical biochemistry they can join, master they can join, PhD they can join. Now after every level of the qualification, their job descriptions are different. Now here the teaching is also added. After the clinical micro or embryo in a master's, they can go in a teaching field also. PhD if they've done, then it's quite good. They can go in a medical college also, nursing college also. So just imagine that how much the opportunities after the all medical laboratory sciences courses. So this is the one where the some people talk, can we go in a medical kind of medical college? Yes, of course. The person who has done, just look over here, according to the NMC rule, the person who has done the biochemistry, PhD, and etc., or my MSc qualification, they can become a demonstration. And if they do the PhD, they can become the full microbiologist, where the person who has done the MD, specialization with the microbiology after MBBS, if the person from MSc and finally PhD in a microbiology, clinical microbiology, they can become a teacher in a medical college also. It is the simply NMC rule. They can fill up to 50% of the position from the who is from the non MBBS background. So here is the registration and approvals, the people where they want to know where this bill has been approved. So there the National Commission for the Allied Healthcare Professional Bill. It is already passed. Just for information, the people are listening this one. Okay, so there are just sector. What I was talking earlier, if you see into this one, this is a Gazette of India, where the medical laboratory professional and the life sciences, these are the person who can work. Histopathologist, hematologist, technologist, medical laboratory. What is this? What are these? These are all the things where the people can work together. These are the sector where they can do the work after doing medical laboratory sciences. So the person was sometimes they are asking the question, can we perform, can we do the signature of the laboratories? Yes, of course. If you are in a hospital, there is no need to worry, because in a one hospital, one laboratory person, one masters, and the one MD doctors required signature. So there is no absolutely required. But if you are running your own laboratory, if you are the masters in a microbiology and the biochemistry, and you have opened your laboratory, so you can, even if you are the PhD, you can do the signature over the reports. But there are the checks of that also. Not all the reports. Few reports you cannot do the signature, like histopathology and a bone marrow cancer, etc. So these are the few that how this All India that they have given the certificate that are you na Vigyan Parishad. They have given that they allow the person to do the signature over the report. So our major placement now, the person, as I said, I talk about that opportunities, whether this is happening here in a LPU especially and other institutions. So we have the several placement also, just lifestyle recruiters, Pathcare, Code Life, Decathlon, Dr. Lalpat, etc. Our alumni are working in a different, junior scientific officer, medical technologist, laboratory executive. What I'm talking about, all these, whatever the designation I talked about, these are all here. The people who are working, right? Siemens Healthcare, the person who is area manager, Ankit, Meera Rani, laboratory technicians. So Vaneet, territory manager. So whatever the name of the designation I have taken, really they are doing the work. Fisher and Paykel Healthcare, Amit Chaturvedi, regional sales manager. He's withdrawing a lot of salary. He has done the bachelor degree from here in LPU, and now he's earning almost 1.5 lakh per month. He's earning because he's a very old students are. So the people are getting the good salary. So these are the overseas also. Firoj Ganai, who is the doing making the one vaccine over the pneumococci. Rupinder Kaur, microbiologist, Nazia, Kabul University. No, these are the person who's internationally they are doing. These are all the students of our department, allied health sciences, who are wonderfully working during the COVID time. They were. If we just see over here, earlier he went from here to the UK. Now he's running almost 10 laboratories in the US. Just imagine the entrepreneurship he's doing. Earlier he went simply for to do the work over there. Now he's that is open their own laboratories. So here, if the somebody want to go, these are the criteria, application they can open, and we have just look into clinical scientist, dietitian, biomedical scientist. Okay, why I'm showing this one? Because Health Professional Council, they are recruiting our student. This is the one designation. I want to simply show the proof. Yes, our students are working as a biomedical scientist in the foreign countries. All right, these are this kind of jobs are coming. Biomedical scientist, St. Joe's Medical, medical laboratory assistant, biomedical support worker. So what is this? These are the NHS National Health Services jobs in the UK. I just simply given one example. So thank you so much. This is the one that I want to give you the brief about the healthcare professional opportunities. Right.
Thank you so much, Dr. Naresh Kumar. So now I would request to the admission nominee, Mr. Rishabh Sharma, to be on the screen. Over to you, Mr. Rishabh Sharma.
Thank you so much, ma'am. Just give me a second. So, before starting, I would like to extend my regard to Dr. Naresh. And I hope my screen is visible, ma'am.
Yes, screen
Yes,
is
yes.
visible. You can continue.
Yeah. So, good morning, everyone. Today we will be discussing about approval and accreditations, ranking of the university infrastructure part, and how you can actually check about the information about the allied medical sciences program, and how you can actually apply for the admission at LP. So, without taking much of time to start with, it gives me immense pleasure to share with you all that LPU is now NAC grade A++ university with 3.684 on 4.38. It is highest score in first cycle of accreditation among all government and private universities. If we move further, we also have NCTE. If we talk about, we have the Pharmacy Council of India, Council of Architecture, Bar Council of India. If we talk about membership, LPU is member of Association of Indian Universities. We are also member of International Association of Universities. If we talk about extracurricular activities, LPU create history. 12 out of 13 LPU students won Olympic medals in all three categories: gold, silver, and bronze. LPU is champions of 37th National Inter-University Youth Festival under the aegis of Association of Indian University, New Delhi. Our students excelled in all the departments, whether it is theatre, possession, literary, fine art, music, dance. So, LPU is also first runner-up for the Maulana Abdul Kalam Azad Sports Trophy 2023, which was awarded annually by Ministry of Youth Affairs and Sports, Government of India. Our students shined at 19th Asian Games. See the level of exposure. LPU successfully hosted 106th Indian Science Congress, which was inaugurated by Honorable Prime Minister of India, Shri Narendra Modi, His Holiness Dalai Lama at LPU campus, two former president in single frame, then President of Afghanistan alongside then President of India, Shri Pranab Mukherjee, alongside our worthy Chancellor, Sir Dr. Ashok Kumar Mittal, Member of Parliament, Rajya Sabha, then Finance Minister of India, Shri Arun Jaitley ji, Venkaiah Naidu ji, Gaur Gopal Das ji, many renowned personalities keep on visiting LPU campus from time to time. We have added few of the slides for you. LPU also hold one Guinness Book of World Record for highest number of people doing Bhangra at a single venue for officially attempting. State of art infrastructure, Shanti Devi Mittal Auditorium with city capacity of around 2,500 people. Labs are there, Library is there, Unimall is there. You can get all your essential and basic needs fulfilled here. Even gymnasium is there within the mall. Bowling area is there. We also have around 50-bedded hospital within the university premises. Aerial view of LPU, lush green campus, clean, green and safe campus, night view of LPU. It's ragging free campus. We also have indoor stadium facility available where we have badminton courts, shooting range, basketball, volleyball, competitive sports, squash courts are there. We also have Olympic size swimming pool, outside view of indoor stadium facility. Now let's go live and let's check from where you can get the detail about the program. So before starting, I would like to share with you all that the University Grant Commission UGC has recognized LPU with the category 1. It's a big moment for all of us here at the LPU that we with the grant of graded autonomy. So now, if we talk about rankings and the World University ranking for innovation, we have been ranked fourth under the World University ranking 2024. We have been ranked 25th. If we talk about NIRF ranking of government, we have been ranked 38th. So if you want to check about all the events that is happening, you can just click here on events and you can get all the details. So now let's see from where you can check all the details about Allied Medical Sciences program, which sir discussed with you during his presentation. So all you need to go do is you need to click on admissions. After that, if you are 12th pass out student, you can click here. If you are graduate student looking for post graduation programs, you can click here. If you are looking for after post graduate program, you can click here. So I have already selected 12th and I have selected here MLT, under which we are offering BS in Medical Lab Technology. It's a 3-year program with 6 semesters, and eligibility says you need minimum 60% marks in 10 plus 2 with English, chemistry, and mathematics or biology or biotechnology as a subject, subject to qualifying LPNS or CUET exam. Otherwise, if you are a diploma holder, you need to pass with 60% marks in 2 years MLT diploma after 12th, 10th or equivalent subject to qualifying LPNS or CUET exam. LPNest is Lovely Professional University's National Entrance Cum Scholarship Test. On the basis of this test, it gives you eligibility. Secondly, you can get scholarship as well on the basis of this particular test. If we talk about fee structure, fees is very nominal. That is 80,000 rupees per semester till 25th of July. In LPU, fees always depend upon the caliber of the student. So you can get up to 35% of scholarship, that would be amounting to 28,000 rupees per semester. You can get scholarship on the basis of your LPUNS performance or your percentage in 12th class. If you can also get scholarship on the basis of CUET, you can get scholarship on the basis of NEET performance. And if we talk about if you have any achievement in sports, cultural, social bravery, social service, bravery awards. In that case, also you can get scholarship. If you are board topper, then scholarship is there. Financial aid is also available for students. Need-based scholarship is there. For defense personnel and their dependent scholarship is there. Financial aid to orphan is there. Financial aid to person with certain disability is there. If you want to check about any of these, you can just simply click and you will be landed to the resulting window where you can check all the details. If we talk about important date, last date of admission is 25th of July with these benefits. Date of exam is 5th June onwards. This exam is being conducted daily till 31st of July. Last date for submission of LPNS application is 3 days before the conduct of exam. Let's suppose today is the 18th. If you want to give your exam on 25th, if 21st, that means you need to book your LPNS exam and your exam slot by today itself. The result will be displayed within 48 working hours. So now how you can apply for LPNS? You can simply click here on apply now, or you can go to direct link, that is admission.lpu.in. Admission.lpu.in. Here you need to register yourself first. Once you register yourself with your basic details, general details, your login credential will be emailed you, and you will get the credential on SMS as well. So you need to log in. Once you log in your dashboard, click on continue to LPNS application. Pay LPNS fees, that is 1000 for male applicant and 500 for female applicant. Once you have paid your fees, book your exam slot and give your exam. Take admission option will be available in this portal only. Minimum provisional fees is 15,000 rupees. Once you pay minimum provisional fees, that is not any extra fees, that is part of your program fees itself. Once you pay that fees, your candidate ID would be generated and you need to submit your document in this particular portal only. So now, if you want to connect with us on WhatsApp, please note our WhatsApp number, that is 985256900. 985256900. If you want to connect with our live video counselor, you can simply click here and through Zoom meeting, you can connect with our video counselors. If you want to connect with our telecounselor, please note the number 01824 517 000. 01824 01824 517 000. Otherwise, you can note 01824 404 404. So that's all from my side. I hope I have covered all the important points. Thank you so much, Dalvinder ma'am.
Thank you so much, Mr. Rishabh Sharma. Sir, already answered one of our participant question. Can we take more questions, Dr. Naresh Kumar?
Yes, 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 please, please.
Yes, someone is asking here, what are the emerging career opportunities in the field of allied health sciences, and how can students prepare to enter these professions?
So once they are from this same sciences, and if they want to go in a means in a hospital or somewhere, they can do the preparation for the examination, entrance examination. है ना? If they want to go in a some kind of in a hospital job, how like a PGI, Biolary Institutes, All India, these are the hospitals which are going to be open, and day by day it's an opening. So there are the lot of openings. They can prepare themselves, and can go in a hospital as a medical laboratory scientific officers. So they can prepare for that. Whatever they have done the study from the same discipline, they are going to ask the question. No other question, only the specific domain related question they are going to ask, and they can be easily placed.
Thank you so much, Dr. Naresh. I hope all the participants got their answers from our experts. As we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding admission. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I will be signing off this webinar. Take care and goodbye. Have a beautiful day. Thank you.